Good. Well, my name's Hannah. I'll be your nurse today. Can I get your name and date of birth? Perfect. And I'll verify that on your bracelet. Alrighty. Well, today your provider has ordered a insertion of an NG tube, as well as the removal. Okay. Can I get your pain on a scale of 0 to 10? A 0? Okay. Perfect. All right. It's a little bit of an uncomfortable procedure, so I'll just have you take deep breaths while I'm doing it for you. Do you have any questions before we start? You're okay? Okay. Well, let me go ahead and do your privacy curtain really fast. And I'll raise your head to the bed a little bit higher. No, it's not the most comfortable. I'll raise your bed for you. Let me go ahead and wash my hands. Alright, and I'll go ahead and start off with taking some vitals for you, and then I'm going to go ahead and apply a pulse oximeter on your finger for the duration of your procedure, so just so we can monitor your oxygen levels, okay? Okay. Alright, we're going to go ahead and get started. Alright, and then before we start, can you go ahead and, I'm going to go ahead and check your nose patency. Can you just put your finger against each side of your nostril and breathe in and out? Okay, this side. Okay, and then the other side. And then can I have you cough for a second for me? Okay, and then I'll go ahead and assess your gag reflex. Okay, perfect. Do you have any history of any broken noses or deviated symptoms or anything? No? Okay. I'll go ahead and put it in your left nostril if that's okay with you. Okay, perfect. Go ahead and get out my NG tube. Alright, before we start, I'm just going to go ahead and measure the tube. So I'm going to hold it up to your nose, okay, to your ear, okay, and then down to your souffle process. And then after that, I will add 15 or so centimeters. Okay. And then I would mark this with a marker or with tape. So I'll mark that so I know where that is. Okay. Go ahead and get some lubrication out. Alright, we have our marked spot, and I'm going to go ahead and dip it into the lubricant. Alrighty, so this is going to be a little bit uncomfortable. It's going to go into your stomach, and I'm also going to, just so it makes it a little more comfortable, I'm going to go ahead and give you this glass of water with a straw, so you can just get some water down your throat so it can help advance the tube so it's not so uncomfortable. Okay, so I'm going to go ahead and have you look up for me, and I'm going to have you take a deep breath, and we're going to advance this, okay? Ready? 1, 2, 3. Okay, and then go ahead and put your head to your chest. Deep breaths out of the mouth. Doing great. All right. You can go ahead and put your head back up. Okay, perfect. And then take some drinks of water. I know that was a little bit uncomfortable. Okay. Perfect. Let's see. Okay, and then we'll go ahead and secure that to your face with some tape. How are we doing? Doing okay? All right. Okay, here we go. Still doing okay? Okay, good. I'll go ahead and tape this to your cheek as well. Now just go ahead and safety pin this to your clothes, to your gown. Just like that. Alrighty, how are we doing? And okay? Okay. Go ahead, whoops. Throw this in the trash. Okay. And we'll take my gloves off. Okay. And we'll go ahead and give you some mouth care. And we'll go ahead and brush your teeth. And I'll just look inside your mouth to check for the placement of the tube in the back of your throat, okay? Okay. Perfect. Now I'll go ahead and open up my kit. Okay. Now we're just going to go ahead and aspirate some gastric contents. Okay. I'm going to put this over your chest. Okay. Just like that. Okay, so what I'm first going to do is go ahead and take one of these swabs. Okay, and I'm going to go ahead and take this off. Clean the port for 20 seconds. Okay, and then I'm going to take my syringe. Put in about 10 milliliters of air. Okay. And then I'm going to aspirate about 5 to 10 milliliters of gastric content. And then we'll put the cap back on. Just like that. Okay. I'll put this into our medicine cup. Just like that. And then we will test that for pH. Okay, and then we're gonna also go ahead and flush out your NG tube, just to make sure all the gastric contents are out of there. So I would put sterile water into here. Okay, and I'm just gonna go ahead and take out about 10 milliliters of water again. Okay. Before I do that, I'll go ahead and do that. And I'll make sure to keep this clamped so that nothing comes out of it while we're trying to do this. Make sure we keep things kinked so nothing is leaking out. go ahead and insert. And I'm going to go ahead and irrigate that solution into there. Perfect. Alrighty. Good job. All right. And the doctor also ordered us to provide suction as well. Alright, so I'm going to go ahead and provide suction for you. Okay, and we're going to keep this clamp so we can put suction on really fast. Okay, and then go ahead and grab suction out. And make sure that the valve is off for right now. Okay, and let's go ahead and connect this to suction. Okay, that's good. We'll go ahead and turn that on, and then I will go ahead and turn this on and to the prescribed amount that your doctor ordered. Perfect. Alrighty. Doing okay? Yeah, okay. I'll probably leave this on for you just for a little bit. Here we go, and I'm just gonna go ahead and also clean some stuff up. Still doing all right though? Okay, good. I'll put this in the garbage. Okay. Take my gloves off. All right, and I'll just lower your bed back down for you. Okay. I'll be back in just a little bit. Here's your call light. Let me know if you need anything, okay? Okay. Hi, how are we? Doing okay? Well, I'm Hannah. I'll be your nurse for today. Your doctor has ordered for your NG tube to come out today. Okay? It's a little bit uncomfortable for me to take it out for you, but once it's out, you'll be happier, I think. Do you have any questions before I get started? You're okay? Okay. Well, I'll do your privacy back up. I'll wash my hands really fast. Okay, first thing, I will go ahead and shut off your suction. I'll go ahead and take that off. I'll turn the valve off. I'll disconnect you from suction. Perfect. Okay. Disconnect the port. I'll throw this in the trash. Alright, let me go ahead and disconnect from your shirt. Okay. And then I'll take the tape off your face, making sure to not rip it off to cause irritation to the skin. If I need to apply some ointment or anything, I can also do that. Alrighty, now it's time to start, take out your NG tube. Okay, so I'm gonna have you take some deep breaths, breathing out of your mouth, okay? Alright, on the count of 3, I'll take it out for you, okay? Ready? 1, 2, 3. Perfect. Okay. Good job. And I'll take my gloves off with that. Go ahead and wash my hands. Okay, how was that? Not too bad? Okay. now, here's a napkin to wipe off your nose a little bit. Put this in the trash. And then I'll just provide mouth care for you again. Okay, perfect. And I'll assess the nares and making sure it's not irritated or anything. Okay. Alrighty, well, that's everything for you. Do you have any questions for me or anything? No? Okay. And then can I get your pain level again on a scale of 0 to 10? A 0? Okay, perfect. Alright, well, I tested your pH of your gastric content and everything looks to be good. And no further questions or anything? No? Okay, well, let me go ahead and put your bed down again. It's already in the lowest position. Do you want your head down? Okay. Okay, and then we'll just leave it how it is. And then, okay. Can I get you anything else? Okay, okay. Here's your call light. I'll go ahead and document everything, okay? Thank you.